Well, we've been today in the All Nations. We've been having a conversation with all sorts of people about the strategy that we're developing. We've had a really good cross-section of people and lots of interest actually, lots of comments. It's a really important part of what we're trying to do, which is shaping how we're going to respond to all those pressures, the challenges that we know that we've got around us. And it's by having these conversations actually that we're going to get a much better feel for what we've got to focus on in the years ahead. So in the room we've had carers, people who look after the people that we serve. We've also had informed members of the public who've come along to talk to us. We've had service users. And actually what's been useful is to see the mix of perspectives and views that people bring to the conversation. And of course that makes our response much richer as a consequence of that. And I think the conversation that we need to have is one that needs to continue. In fact, one of our contributors today was really challenging us actually to continue to have a meaningful dialogue with the public and with our service users, and it's something that we need to give a lot more thought to. If we want to reduce this gap that we've got between the people who are most likely to lead healthy lives and most likely to live longer, if we're going to close the gap between them and those who have a greater chance of having an unhealthy life and living, in fact, less time, we've got to think about how do we design what we do differently. And our philosophy is, based on all the feedback we've had from the contributors over many, many months now, is we must start first and foremost by thinking about the home first. What is it that will allow us to keep people at home or near to home rather than being swept into a system that takes them away from that very important part of the world that they inhabit? Alongside that, we need to make sure that we've got a uniformity of quality and safety in the way that we work, so that the way we deliver our services avoids waste, harm and variation. Equally, we've got to ensure that the outcomes that we are talking about delivering matter to people. It's not enough for us to perform an operation successfully and for the wound to heal. Actually, the reason why we had the operation is something we need to agree with the patient, and that outcome is what we're aiming to deliver, not a successful operation. So over the course of the last couple of weeks actually, there's been a couple of really great things that I've been able to do. First of all, I had the chance to have a look at the Landoc mental health unit as it's being built, and I am overwhelmed with how fantastic that is. And actually that's a really strong story about how service users can actually influence not just the services that we provide, but also the environments within which those services are going to be provided. It's fantastic, and I'm looking forward to the day when that facility opens about a year from now. In addition to that, we invited the BBC, the senior editorial team from the BBC, who carried out the Health Watch Week with us, to come to the hospital, the UHW site, earlier in the week, and we had the chance to show them around and show off, actually, quite honestly, the new children's hospital, and they were absolutely astonished and amazed and impressed with the fantastic environment that we now have for looking after our children. And I think it's something that really has sunk in just how great a facility that is, and I'm sure that we'll be able to work with the BBC to tell that story really well for the public over the weeks and months to come. So actually one of the interesting things that's happened to me in the next month is I'm going to become a mystery shopper. I'm going to have a small minor operation in our organisation, and I'm hoping that to some extent anyway I'll get to see it from the patient's perspective. And having been a patient previously, I do think there's something really important about just seeing it through the eyes of a patient. There's nothing quite as insightful as actually lying there, putting your trust in other individuals, and I have no doubt that I'll have a good experience, but I am going to be interested to see just exactly how it feels to be a patient in our organisation, and perhaps I'll let you know how I get on in the months to come.